Today, I'm Ali Foti. I am a program officer with the New York Health Foundation in our Empowering Healthcare Consumers priority area. And I'm so pleased to welcome you here today to our conversation around raising consumer and community voice when hospitals are consolidating. So why are we here today? New York's healthcare delivery system is changing rapidly. One of those major changes is increasing hospital consolidation. And what does this mean for New York's patients and consumers and communities? At times, hospital consolidation can mean that there are threats to healthcare access and increased prices due to reduced competition. Sometimes mergers can mean that there's preserving access in local communities to healthcare and the benefits of consolidating with a larger system. But regardless, what we know is that consumers don't have a say in this process. And without this consumer say, we can't know what those advantages and disadvantages in local communities truly are. And so with us today, we have speakers that are going to share with us the strides that we've made in centering patients, consumers, and communities in the decision-making process around hospital mergers. I have with me today Brandon Wilson, Director of the Center for Consumer Engagement and Health Innovation, as well as Lois, Uttley, and Faith Daniels with the Hospital Equity and Accountability Project, all with Community Catalyst. We have Arthur Butler and Michelle Ostrelich. In addition to their important day jobs, as they are also co-founders of the Schenectady Coalition for Healthcare Access. And we've got this esteemed, diverse panel here to be able to share the strides that New York has made in placing consumers in a decision-making process around hospital mergers that otherwise isn't transparent, isn't consumer-friendly, how consumers are playing a more active role in providing their input in communities and in the decision-making that happens on these hospital transactions. With this level setting, we have the Schenectady experience to share more with us around what this has really meant in communities, the tools and models that exist that other communities across New York State can use to center patient voice in these hospital merger decisions. And lastly, we'll preview a toolkit of what other communities can use to amplify consumer voice in the process. So with that, by way of an overview, I'll also just do a bit of housekeeping. So first and foremost, you all see that there's a chat function. It's no news to anyone for Zoom, but please offer your questions via the chat. I will be monitoring that and lifting up questions as they emerge. I'd also encourage you to make this interactive in the chat as well. Offer who you are, your name and title. Let us know you're with us and questions and comments you have along the way. You'll also notice at the bottom of your screen that there's a closed captioning option, both at the bottom button and a top banner for those in need of closed captioning. We are going to be recording this session and we will share that recording as well as materials from the event with us all after the fact. So with that, by way of logistics, I now have the pleasure of turning it over to our speakers today. And with us to kick us off and level set is Brandon. So Brandon, please take it away.
Yes, thank you, Ali. And thank you everyone and welcome to joining us for the New York Health Foundation's webinar on community voice in hospital consolidations. Our healthcare system is really quickly changing, and people with the most at stake, individuals and their families, often have no say in that process. This is especially true for people who are frequently left out of or harmed by policies and practices, decisions, including BIPOC people, people with disabilities, those with complex health and care needs, LGBTQ+ people, immigrants, older adults, and women. When decisions about our healthcare system are driven primarily by profit, patients and their families often suffer. That's why here at Community Catalyst, we work in collaboration with our partners across the country, and we advocate for a healthcare system that's equitable and responsive to all of our needs. We apply a race equity and health justice lens by centering equity, harnessing and making progress on bold ideas, and building power and unity. We believe that when we come together, that we really can drive policies that make our public health and healthcare delivery systems accountable to our communities, while supporting civic engagement and embracing the roles of community-based organizations and grassroots coalitions alike. Our co-created strategies can really shape a community-driven public health system that connects local, state, and national efforts across a range of public health issues. like envisioning policy changes that dramatically expand who can get covered, make enrollment experience more efficient and intuitive, expand what benefits are covered, and ensure access to trusted providers no matter where you live in this country. It means building support for change in practice and policies that reduce the cost of care, end unfair and discriminatory billing and collection, eliminate deductibles and lower caps on out-of-pocket costs. The way that hospitals and health systems are financed and reimbursed should not come at the expense of patient affordability. The way that hospitals and health systems are financed really should also improve the care experience for patients and their families, increase staff well-being, ensure equity, and improve population health outcomes. We know that when care isn't given to the way that hospital consolidations and mergers occur, that there are equity concerns on both price as well as healthcare and access, especially in medically underserved geographic regions. When mergers happen, sometimes prices go up. This is a well-documented trend for hospital consolidations and leading to increases in the price of healthcare, despite pre-merger promises of greater efficiency and lower costs. Medical debt increases, as do aggressive billing practices. People who are uninsured or underinsured face impossible choices of avoiding expensive but needed medical care or facing financial ruin and even medical bankruptcy. Urban and rural communities of color lose their hospitals, and affluent areas really gain, and we leave behind those who really need services the most. Continuity of care is interrupted when hospitals close, OB services, ERs, and ICUs. Communities lose control of their hospitals. In the most recent CMMI blog, the administration realized that the ongoing trend of market consolidations is also a relevant factor impacting access to care, and it potentially dampens the goal of achieving person-centered care and value-based care for our healthcare system. So we work to ensure that community members and partners, particularly those from underrepresented and vulnerable populations, have a strong voice and receive the support that they need to participate in hospital efforts to identify and address community health issues. We identify opportunities to collaborate with leading community hospital and public health leaders to identify the next generation of community benefit work and tools kits that can be helpful in driving policy and practice change. So welcome again. Thank you all for joining us. And a special thanks to, again, the New York Health Foundation, to Community Catalyst, as well as Schenectady County staff for making today's webinar possible.
Thank you, Brandon. Thanks for grounding us in hospital consolidation, what it really means for access and equity, its implications, and setting that stage. And with that, Lois, we're going to have you kick it away in terms of the evolution of this work in New York over the past few years.
Absolutely. Thank you, Allie, and many thanks, Brandon, for an excellent introductory overview. I think Allie is going to put up some slides. Yes, thank you, Allie. So I want to start by, again, thanking Allie and the Foundation for their support of this work. Our team that's been working on hospital mergers and consolidations has had really 6 years of support from the Foundation to raise the consumer voice and at the same time reform the health system. So yes, thank you, Allie. I'm still on the first slide. We are concentrating in the grant work that we're doing right now that's going to end very shortly on raising consumer voices. But first, I'm going to give a little overview of how the health system has been changing in New York and perhaps what we need to do to make the state oversight process more community and consumer friendly. So yes, next slide, Allie. Thank you. As Brandon pointed out, the healthcare system is changing rapidly. Specifically here in New York, we have seen more than 40 hospitals close over the last 20 years. Some here in New York City were on base, but also many in upstate. Those hospitals that remain open, the majority of them now have joined large health systems. And there are benefits to joining large health systems. You know, it's a sort of shelter for financially stressed hospitals sometimes, can provide, improve the quality of care, you know, stabilize finances in some cases. But there are also some risks for the community. These systems may downsize the hospitals that they acquire by closing the maternity service, the ICU, psychiatric unit, other units, sometimes the ER, and directing patients to system hub hospitals. I'm sure you're all familiar with that McKinsey and Company model of the hub and spoke health system, where you have one hub that is the highest care of hospital. And then you have a lot of smaller hospitals with less sophisticated care, intensive care out at the spokes, and sending, you know, patients from those spokes to the hub for certain types of care. That has some advantages in terms of quality, but it also can inconvenience patients and, you know, disrupt their provider relationships. Another impact can be that decision-making may shift away from local hospital boards to system governance. So when decisions used to be made at the local level by local hospital board members who are familiar with the community, now the decisions may be made by system executives some distance away from the local hospital. Next slide, please, Ali. So there is state review of proposed consolidation. The last time my group did a study of this, there were 36 states that had some type of certificate of need process. New York does have such a process. However, you know, there are some problems with it, which I'll get into in a minute, but it's also important to note that there is presently no real system of regional health planning in New York to forecast the need for beds and encourage or reward proposals that meet those needs. So the applications from health systems to make changes come in, and there's really nothing to compare them to at the regional level. We also have been seeing, especially in the last couple of years with the pandemic, urgent care centers and retail health clinics have been assuming a increasingly important role in the health delivery system. Certainly a lot of people have gone to those urgent care centers for testing and COVID diagnosis and treatment. But those particular provider types in New York are not subject to review under the state certificate of need system. Next slide, Ali. A study that the Health Foundation funded a few years back by our team found that the state CON process is not consumer friendly and needs considerable reform. Communities that are affected by consolidation do not have enough notice or say. This is particularly true with closings of hospitals, where there may be very scant notice that the hospital is going to close. And in all cases, there's no requirement for a public hearing in the community or really strong attempts to reach out to community members to say, what will this mean to you? What would this change mean to you? How would it affect your access to care? And what could we maybe do to mitigate the impact? The CON applications are reviewed by state health officials, and the most important ones go to a state review board, which is called the State Public Health and Health Planning Council, or FIPIC for short, for those of us who have a lot of interacting with the council. There really are a lot of representatives of big health systems on that council, including the chair. And there has not been enough opportunity for consumers and communities to have a say. Recent progress, and with the support of the New York Health Foundation, We now have 2 consumer representatives on the 24-member board, and I'm delighted to say they're both doing a great job speaking up, asking the questions that should be asked, and raising the concerns that communities have about each of the proposals. Next slide. With the support of the Health Foundation, a group of us got together and formed a statewide coalition called Community Voices for Health System Accountability, or CVHSA for short. Here are some of the groups that are involved in CVHSA. And you can see we have a pretty wide representation of different types of consumer groups that are very good at analyzing what consolidation might mean for their constituents and helping to weigh in at the state level. Many of us in this group monitor those HEAP meetings very regularly and try to keep track of what proposals are being considered. Next slide. We've also, the CVHSA members, been working hard to reform the state review process to make it more consumer friendly. So in addition to giving consumers more seats at the table in those HEAP meetings, we're delighted that Governor Hochul has signed into law a new Health Equity Assessment Act, which will go into effect in June of next year. Here's what it would do. Applicants submitting certificate of need proposals, such as hospitals that want to consolidate, will require to submit an independent assessment of what the impact of the proposed change would be on medically underserved people. The law requires meaningful engagement of affected community residents, and we're hopeful that it would help identify, potential negative consequences, such as services would be reduced or people would have to travel somewhere else for their care. It could also reveal whether new proposed facilities would actually improve access to care for medically underserved people, or in contrast, mostly serve more affluent people with commercial health insurance who already have decent access to care. So we're very hopeful about that new Health Equity Assessment Act. Next slide. I just wanted to underscore who are the medically underserved New Yorkers whose future access to healthcare would be assessed through this process. And, I want to note that the sponsors of this law, Gustavo Rivera, the Senate Health Committee Chair, and Dick Gottfried, the Assembly Health Committee Chair, crafted a bill that has a very inclusive definition of medically underserved New Yorkers, including people with low incomes, racial and ethnic minorities, immigrants, women, LGBTQ+ people, people with disabilities, older adults. This was very important to the statewide Senior Action Council that's part of our coalition. People living with a prevalent or infectious disease or condition. Dick Gottfried was thinking about people with HIV, but then COVID came along. And so that's another thing that needs to be considered. People living in rural areas. This was very important to gaining the support for this legislation from legislators representing people in rural areas. So this has been a very exciting development. We're looking forward to the rules that will implement this law and seeing it go into effect very shortly. So Allie, you could take that, you could move on, yes, to the slides about Schenectady. So in addition to working to reform the state certificate of need process, we've also been supporting coalition work on the ground in several communities across New York. We've been documenting best practices and lessons learned, really to share with other communities through a toolkit that we're developing. There are, of course, many different types of proposed mergers, downsizings, and closings that communities are facing. We're going to just share one case example, which has been taking place in Schenectady County, which is located in the Capital District. And to help tell this story. We're going to be joined in this discussion by Michelle Ostrelich and Arthur Butler. Let's turn to Michelle first. Before we take on this coalition work, let's ask Michelle to briefly explain to us what type of hospital consolidation has been proposed for Schenectady, and why is it worrisome to people in the community?
Thank you, Lois. This is Ellis Medicine that we're talking about in Schenectady, New York. They were struggling financially for several years, operational losses that were growing year after year. And so they were very proactive in looking for a partner, and they pursued and chose St. Peter's Health Partners to be the system to align with, of one of two larger healthcare systems in the capital region. So they chose St. Peter's, and they have a better financial situation, certainly, than Ellis. They have a better capacity to recruit practitioners, which is an issue in upstate. It's difficult to recruit up here. And they also have higher quality ratings. So it's very helpful to know that those are the main reasons that were identified by the hospital for needing a partner. And they've also said that it's an apparent help that it's part of a larger healthcare system, which is Trinity Health. With every merger, there's going to be risks and benefits. And our community was particularly concerned about the risks that departments and services could be eliminated or moved to a different location for financial or business concerns. But in particular, because a Catholic healthcare system was chosen, it also brings along religious restrictions. And that can affect reproductive and gender affirming care for sure. We know that. What worry people the most is that we have Bellevue Women's Center as part of Ellis Medicine. It's a separate campus, and it's very well regarded. It's a regional women's health center that provides excellent comprehensive reproductive services and maternity care that we didn't want to lose. It has a long history here, and it's very beloved. Also, it's important to note that our coalition really never opposed the merger in particular. We understand and appreciate the financial concerns and parameters that our local community hospital is working under. And we never even publicly opposed the choice of this partner, mainly because they initially joined this deal as an exclusive choice. So they just isn't practical to make any objections about the fact of the merger, the need for a merger, or this partner in particular. But we do recognize that we have a very common goal, that is preserving hospital-based services in our community. And we take that obligation in all of the work that we do very seriously. Our purpose is to educate our community and the administration about the risks of the merger in particular, but also to help in any way we can to mitigate the risks to cuts in services, especially those that will affect our residents who are already facing barriers accessing healthcare.
Thank you so much for that overview, Michelle. I want to turn to Arthur now, and you can leave this slide up, Allie. Can you explain a little bit about how you and Michelle came to co-found the Schenectady Coalition for Healthcare Access, and talk a little bit about what the coalition has been doing?
Sure. Thank you for having us on, and thank you for lending an ear to us here in Schenectady County. As Michelle said, once we heard about the pending merger through shared interest and values, came together and had conversations about possible next steps. We thought that it was important during these pending changes and the impact that it would have to our residents here in Schenectady County that we start pulling together people who had shared values, shared interests. And so with those things, as the underpinnings began to build and cultivate relationships between stakeholders in Schenectady County. And that included a cadre of people from different walks of life, organizations. We had conversations with administration at hospitals. We had conversations with anyone who had a shared value and shared our vision, and so that began our process in pulling together people so that we could start to strategically look at what our wants, what our concerns were, and then how we were going to be able to articulate those things. Once we came together, we came up with some great ideas around coalition building and the community engagement. And we hosted a public rally, and we had an online community forum, because even though we found ourselves in the midst of all of the changes that COVID was presenting, we thought that it was still important for us to bring those voices together. That being said, at our disposal were, the virtual calls and virtual meetings. And so we held a community forum, and we were very focused on what the community might say, or what they might ask, and how that could help to engage administrators at the hospital level. They were invited and participated in this community forum. We had a robust conversation. We met with neighborhood associations, anyone and everybody who would listen or who had an opinion how to bring those together.
Right. This has been a very inclusive coalition, and I really have to credit you, Arthur, and you, Michelle, for getting so many different types of people involved in it. I do want to go on to the next slide, Ali, and ask Michelle to talk a little bit about how the coalition has been interacting with hospital officials.
Sure. The hospital administration has been very welcoming of our one-on-one conversations. I've had conversations with our CEO early on a regular basis. We talked about all of the many issues that go into a merger. I asked lots of questions, and he was able to answer a lot of them. But with the caveat of the merger had been announced and not much movement had happened. So they didn't have a lot of specifics. And that's, of course, where the community wanted to know the specifics, because they were nervous. We're all nervous. He also later presented to the city council and to our county legislature. I'm a member of the county legislature, and he spoke with private groups like Rotaries. So he has gone around the community as well. And then the hospitals essentially said they were pausing their merger, but what they were doing was negotiating a management services agreement. And that agreement was, we were told, to protect reproductive health care services. And we weren't exactly confident about that, to be honest. There was a point we had filed objections with the Department of Health. There isn't a very clear process to management services agreements of how they are approved, or any guidelines for why they wouldn't be approved. So we did essentially a letter to the decision makers with objections, because once the hospitals start to intertwine, it's awfully difficult for them to unwind. So because we had filed those objections and there had been a delay in a decision, the administrators did reach out to us to ask us to withdraw our objections. And that allowed us a moment of offering a couple of our resources. So one of our resources was language that members of our coalition had worked on. They're a statewide legal organization that has partners in the rest of the country, and have partnered and reached out to their colleagues to provide us with language that could have been helpful, making sure that we preserve as many services as possible that we were concerned about, not just for year 1, but year 5 and 10. And but the Department of Health did end up approving the management services agreement. So we didn't have a chance to really work on any additional language that could have been negotiated into that management services agreement.
Lois and
Yeah.
Michelle, I'm going to pause you for just one moment because I see a question come in through the chat. And this was around what the merger in Schenectady could have meant for community benefits among the local hospitals of Ellis or St. Peter, their community benefits, and how this impacted Schenectady Hospital's role in the New York State prevention agenda. Do you, Michelle, Arthur, Lois, have anything to share on that front?
That was not really a subject of any of the conversations that I'm aware of between the coalition and the hospital system. Is that anything you, Michelle or Arthur, recall?
No, we did not have the opportunity to talk about community benefits at that point. We were hoping just to make sure that we were both good community partners.
Right. You know, I want to underscore something that Michelle talked about, which is that it's not a full merger, it's a management services agreement, did not go through the certificate of need process. So all the effort we've been making to try to get consumers at the table, make the process transparent, you know, improve community engagement, none of that happened with this particular route that the hospitals chose to go. And I think some of the coalition members ended up feeling pretty frustrated at not having an opportunity to give testimony or, you know, really weigh in more publicly. Let's go on to the next slide. So since the management services agreement went into effect, the coalition has been, you know, pondering what does this mean, trying to figure out what the impact might be on the community. And the latest thing they've chosen to do is to conduct a community health impact survey. I want to ask Arthur to talk about this just for a minute.
Sure, thank you. Part of those frustrations and to be able to maintain a sense of community empowerment and influence in the process was to create an ad hoc committee within the coalition to work on a community assessment tool to find out about the impacts of the merger and the loss of services, and to hear voices from the community around services that they had received since the merger had been announced. And because of that, we created this tool. We've been developing this tool with our coalition partners, and we're ready to launch the assessment tool. We are working with universities. Of course, we have some additional funding through and support through the foundation and other groups that will help us to hear those voices, hear those concerns, and to be able to collect that data and really look at specific impacts on the medically underserved in the communities. So I
That's
hope that
great.
answered it.
Yeah, thank you, Arthur. Allie, I think we could take the slides down now and we'll just have a few minutes of conversation among myself, Michelle, and Arthur. It's a great opportunity to just talk a little more informally with them. Arthur, maybe you could talk a little bit about why is it so important to have the community voice raised in situations like this? What value does it bring?
I mean, we have a history of how important and how valuable it is to have community engagement in the process. I mean, any of our larger movements throughout the history of this country that engage the community, the benefits were always outweighed the sense of loss by community. And, you know, from our perspective at the coalition, we knew that, you know, in moments in time such as these, that there are times when not only are the community to stand up and be a part of, but to add that voice. And sometimes that voice can be done in a whisper, and sometimes it can be done loudly. But it's important for us not only to be at the table, but it's important for us to tell the stories of the community in which these services have had a direct impact.
Yes, you're so right, Arthur. Thank you. Michelle, you're a Schenectady County legislator, and you're one of the public officials been engaged in and supporting the coalition's work. Can you talk about how the involvement of public officials like yourself has been beneficial both to the coalition and to Ellis Medicine?
Absolutely. I think it's important to lay the background that any community hospital has a really symbiotic relationship with the community, certainly. So community relies upon a community hospital for their health and all of the services that they provide, but also the community supplies the hospital with employees and volunteer hours and donors. The state gives lots of tax incentives and money to support indigent care and give them nonprofit status. And we also certainly give them, all of our tax dollars, just making the hospital safe and accessible. So our relationship really, our community needs the hospital and the hospital does need the community. As an elected official, I can give you one example of very definitive way that having a coalition did help. So early on, just before the announcement of the merger, Ellis decided to eliminate its dental residency program, which provided a dental clinic, a Medicaid and non-paying patient dental clinic. It serviced 9,000 residents a year. And when that closed, they had assumed and hoped that our only other Medicaid provider would take on all of those patients, but they didn't have the capacity. And there was in fact a dental clinic of dental providers that had warned Ellis that we would be losing the capacity. And Ellis did provide them with space, but didn't do much by way of bridging staff or other ability to take on the extra patients. So since then, we have learned, because some of the patients are part of this coalition, that people have gone without regular dental care, which is a real tragedy. So when our other Medicaid provider realized that they could not fulfill the additional need, they bought another property and they have plans to open it as a much larger dental clinic that would be able to have the capacity, but they had a shortfall in being able to completely fit out that building. They needed $3.5 million. Because myself and other elected officials are part of this coalition, we knew from the dental coalition what was being lost when Ellis closed their dental clinic, and we knew what an impact that was going to have in our community already. We were already predisposed to that. So when that other provider was in need of money, we were able to step in and provide them $4 million to go ahead and finish that dental clinic, which should be up and running in a year or so. And that's just one very, very concrete way when we talk about our coalition being a group of residents and local folks that care deeply about medical care in our community, resources that we can bring to the table. That's certainly one of them, is finding alternative ways of providing care that may have been outside of this merger.
That's a great example. Go ahead, Alex.
My apologies, Lois. I wanted to chime in with a few different questions from the chat box. So first of all, everyone keep those questions coming. Thank you. I have two questions for you, but first of all, so there was a question around patient populations using the Schenectady example. Is the patient population of Ellis different than the patient population in St. Peter's? And if so, what, if anything, can we glean about that from the equity implications? Are there differences in the racial and ethnic composition of patients in the two hospital systems, or any other equity considerations as we think about access that needs to be factored into this example and raising community voice here?
Well, first of all, I would say that St. Peter's is based in Albany, whereas Ellis is in Schenectady. Schenectady has been a struggling community for some years since the General Electric plant there shut down. It has quite a few immigrants. It has a significant low income and Black population. I don't know, Michelle and Arthur, anything you can add there?
Our health disparities are well documented. So although Ellis serves all of Schenectady County, there is a large portion of population that is uninsured or underinsured. So the payer mix isn't necessarily community hospital sustaining. And also we do have a significant population that will not travel for medical care, whether they don't, it's much easier upstate to travel by car, and many people don't have cars, and public transportation is prohibitive. And if you have other family obligations, work obligations, a million other things going on, more likely folks will choose to go without care than travel to Albany, even though it seems like it's only a half hour away. It's a significant enough difference to mean people will go without care.
All right, I'm going to chime in with one more question here from our chat. And I believe, Arthur, this is for you, which is around the survey development. So what's the status of the survey? Is survey development ongoing? Did planning for the survey start earlier on in the merger processes? Can you give us a sense of timeline, or any or all of you give us a sense of timeline for the health impact survey development and fielding?
Sure, we were working on many different fronts at the same time. And so working on this survey was one of, from the start, how to engage community, how to hear the voices of those going to be impacting going forth in the merger. So we worked as a team while dealing with other issues to develop this tool and to make sure that the tool was an effective way of looking at what that impact was going to be. We have finished it, but as we get new partners in, we find out that maybe there was a nuance or something that we may have left out. And we wanted to make sure that this was the most in its entirety, because it's a short survey. We also thought that it was important for it to be short in nature, to be able to speak to the heart of the conversations, knowing that it was important that Ellis Hospital is a community hospital, and the people on the coalition were doctors and spouses of doctors and dental residents and community colleges and the community. So pulling all of that together was quite empowering, but we have finished the survey. It's up and running. We have incentivized the survey in terms of getting it out to as many people. We're working on campaigns now for platforms so that we can get the word out. I work for Schenectady County Human Rights as their executive director, and our county manager has supported us in a way by putting the survey in the newsletter and also alerting county employees to, take the survey. We want to hear your voice. So it's ongoing and it's a work in progress, and we continue to develop it.
We're very excited that the coalition is about to launch this with a very well thought out campaign of outreach, both online and in person. Do we have time for one more question from me, Allie, or should we move on?
Let's say one more quick question, then I have a question from the chat, and we'll wrap things up with the toolkit.
Okay, great. Here's my question for Michelle and Arthur. What recommendations do you have for other communities who may find themselves in this situation? What are your tips for other folks who might be forming a coalition?
That's great. I would say definitely just make lots of phone calls. So we did reach out to electeds. We reached out to nurses and the nurse union, NYSNA, and we reached out to statewide organizations that have been through mergers like this before, which was incredibly helpful. So learning and listening from everyone, having weekly meetings is certainly very helpful. for continuity's sake, and real action items. So like Arthur mentioned, the forum, planning a rally, and regular communications, both with the administration and then by e-blasts, sending out to interested parties.
Yeah, you've done a great job, both of you, at keeping the coalition going over what's becoming quite a long period of time.
Yeah, thank you. I'll just add to that, that we stayed on message. Once we were at the table, we stayed on message. When we spoke, and then we had talked about what the importance of what it was that we were doing, that community came first, and we stayed on that message. We didn't splinter, as sometimes happens when coalitions are brought together, that once inside the door or at the table, people have various needs or values. We understood that we needed to stay united in what it was that we were doing, and that's what we did. And that's my recommendation in building coalition: stay united, stay focused, and stay on message.
All right, with that, I'm going to have us transition. Michelle and Arthur, I'll call your attention to the fact that there are a few specific questions in the chat around community-based organizations involved in health departments, so weigh in if you can there. Lois and Faith, as you transition into the toolkit, I'm going to pull up the slides, and while I do, I wanted to pose one other question from the chat, which is around the Health Equity Assessment Act and those requirements more broadly. So the question from the chat is, who is responsible for conducting those assessments? Is it the health system applicants themselves, independent assessors? Can you help us understand who's playing a role in those assessment processes?
Yeah, excellent question. The law calls for an independent assessment, and we are hopeful that there will in fact be a group of independent assessor entities that can do this. They will have to be hired by the hospital, because the hospital has to submit this assessment along with its certificate of need application. Our consumer advocacy groups have been urging that assessor entities be organizations like schools of public health. There are quite a few good ones across the state. Or there are some nonprofit organizations such as the Arthur Ashe Institute in New York that would be capable of doing that kind of a survey. We are now awaiting release of draft rules implementing the Health Equity Assessment Act, and we will look and see what the health department thinks in the way of who should these assessors be. We want to make sure that they have no conflicts of interest, that they are not otherwise involved in preparing the CON application for the hospital. So, as I've said a couple times, we are taking the lessons learned from the Schenectady Coalition and some of the others we've been working with around the state, including in Lower Manhattan. There's been a whole coalition looking at Beth Israel Medical Center and now New York Eye and Ear. We've certainly looked at the Montefiore plan to close Mount Vernon Hospital. We've been looking at Montefiore's clinic consolidation in the Bronx. So we're drawing from all those particular coalition work and putting together a toolkit. And you'll see a mock-up on the right there of the cover of this toolkit, which is entitled "We Deserve a Say." And that's on purpose because we very firmly believe that communities deserve a say in the future of their hospitals, and that frankly, it's to the benefit of hospital officials to engage the community at all times, but certainly in starting to evaluate what would be the best plan for addressing either financial or quality concerns. Talking to members of the community ahead of time can help hospital officials identify likely negative consequences for medically underserved people and potential ways to address those problems, right? So, for example, there might be a need for patient navigation and transportation if the hospital is going to close certain units and direct patients to other facilities within the same health system. So the toolkit's going to cover all the essential elements of community organizing that are needed for effective residents to gain a say. We will talk about how to make an inclusive coalition, the benefits of having doctors and nurses participating, important to engage key groups in the community. For example, the NAACP chapter in Schenectady has been very active in that coalition. Also, local houses of worship and neighborhood associations. Really, our advice is the more types of people you're able to engage, the better your coalition will be. Let's go on to the next slide, and I will turn it over to my colleague at Community Catalyst, Faith Daniel, to present this slide.
Thank you so much. So the Schenectady Coalition has been particularly successful in engaging the local news media. And, oh, I'm so sorry. Wrong slide. So another section of the toolkit will be giving step-by-step guidance on how to organize the community forum and to educate people in the community, or to hold a public rally to gain the attention of local officials and the media. The toolkit will explain some of the key decisions the coalition will have to make in planning one of these events. So for example, for a community forum, which organizations could be co-sponsors and what would you expect them to do? Send invitations to their members, contribute to any cost of holding the forum, such as refreshments, if it is to be held in person. Another question is, who should you invite to be speakers at this forum? Should you ask hospital officials to speak at the forum, or just listen to community concerns first? For a public rally, how do you go about choosing the best date, time, and location to ensure maximum public participation and visibility? And lastly, how do you find out if you need a permit to hold this rally? So all these steps will be covered in our toolkit. Next slide, please. So the Schenectady Coalition has been particularly successful in engaging the local news. And here in this slide is an example, as you can see, Arthur doing an interview with the local TV news during their rally that was held in July of 2021. The toolkit will offer some examples of effective media outreach by the coalitions we've been working with. And Anna will help answer some questions such as, when should the coalition issue a press release and how do you write one? When is a press conference a good idea and when is it not necessary? And how do you go about writing and submitting a letter to the editor of the local news, or even writing an op-ed piece? And when is social media the best way to get across your message and reach target audiences? And lastly, seeking folks that have expertise in communications or in marketing is definitely a key recommendations that we would have for folks. Next slide, please.
Wonderful. Thank you so much, Faith. And finally, a very important section of the toolkit will explain how coalitions can bring their concerns to the attention of state and federal regulators. As I noted earlier, the state certificate of need process really not very consumer or community friendly. When hospitals submit CON applications to the State Department of Health, it's not easy for the community to learn about the hospital plans, get a copy of the application, and weigh in during the state review process. So the toolkit's going to explain how that process works and also how it will be improved somewhat when the Health Equity Assessment Act goes into effect next June. The toolkit will also explain the role of the State Attorney General and the Federal Trade Commission in examining whether a proposed merger or acquisition could have what's called an anti-competitive effect. In other words, will it increase a hospital or health system's market share of the local provision of hospital care so much that the hospital would be able to increase prices because there's little or no competition? So we look forward to issuing this toolkit in early 2023. And again, we want to thank the Health Foundation for all its support of our work in recent years to reform the state CON process, empower local communities, and give consumers a say in the future of their hospitals.
Thank you all so much. This presentation, I mean, it's shocking we did so much in an hour, but this presentation really gave us a great sense of the evolution of this work and how consumers have had a more meaningful say. The Schenectady example really brought it to life. Thank you both so much for examples, Michelle and Arthur, and Faith and Lois. You're describing the nuts and bolts of what this toolkit can offer. Thank you so much for sharing your insight. Attendees, you can all realize that we just scratched the surface with this discussion. So I would encourage you to stay connected with our speakers to learn more about their great work. Thank you so much for all your engagement in the chat, your questions and comments. I apologize that we couldn't get to all of them, but thank you for joining us. Many thanks to my colleague Michelle for making this event possible. And with that, I'll just close with our few last logistics, which again, you'll receive an event wrap up, a recap with the recording and the slides from today's conversation. And I also will say, stay connected with the foundation. Follow us with our newsletter on Twitter and otherwise to see other events we have coming down the pike. And thanks again, everyone. Have a great afternoon.